Hello, this is Dr. X, a doctor working here today. May I confirm your name and age, please?
Hello, doctor. My name is Wilson Lilly, and I am 52 years.
Okay, how may I address you?
Please call me Wilson.
Okay, Wilson. Today we are going to discuss about your health issues. Is that all right?
Okay, doctor.
During our conversation, I might take down some notes, which will be strictly confidential. Is it okay?
No problem.
Okay. So Wilson, can you please tell me in your own terms what has brought you here today?
Okay, doctor. Actually, I was at my work, and suddenly I noticed that I have some headache, and my headache was on the left side of my head. And within a few minutes of the headache, I noticed that I have some abnormal sensation, a funny sensation. I cannot really express that what happened to me. And some numbness, some abnormal sensation on my right side of the body. And I also noticed that I cannot feel my right side properly. That didn't happen to me before, but the headache was not something unusual, but this type of symptom was unusual, and that is about for 3 hours. Though it is somewhat resolving, but I cannot feel properly normal. So I visited my GP and he sent me here.
Yes, I get it. We will try our level best to find out your cause, what is causing these symptoms. You told that you were at your work. Can you please specify that what were you exactly doing at the time when the headache started?
Actually, I am a office clerk, so I have to type something, print something, and I was doing that at that time.
Okay, okay, okay. And did it come along suddenly, this headache,
Yes, doctor.
or gradually?
Quite suddenly, quite suddenly.
Quite suddenly. Okay. Okay. You told that it's occurred in the left side. Well, can you please specify that it says the anterior? Well, it's more in the anterior portion or in the back side. Can you please tell me
On my
the front or back side?
on front side and some side on left side, not
Okay. Okay.
quite
Uh,
point area.
yeah, okay. And you also told that there are some abnormal and funny sensations in your right side. And can you please tell me that headache and this funny sensation both came along at the same time or one after another?
No, headache came first. After that, I noticed the sensation.
Okay. And but can you please tell me that after how much time you started to feel that sensation after starting headache?
Maybe 15 to 30 minutes.
15 to 30 minutes. Okay. And what happened to the headache at that time? Was it persisting?
Yes, doctor. I even now I have the headache, but the headache wasn't something severe. So
Okay.
I can tolerate this type of headache.
You can tolerate this type of headache. So you seem familiar to headache. Can you please tell me that do you have any previous headache episodes? Any history of headaches previously?
Yes, doctor. I was a case of diagnosed with migraine for a few years, and that comes and goes. For that, I am taking some medication. Usually, when I feel the headache, I take paracetamol. So headache isn't something new to me, but this sensation
Oh,
is new.
okay. Well, this headache is like other headaches that you have experienced before, or is it something different? This type of headache, today's headache.
Actually, in the previous headache, I sometimes before the headache starts, I felt that I am feeling somewhat nauseated. I feel somewhat abnormal
Hmm.
vision, and after the headache comes, and during the
Okay.
headache, I usually cannot tolerate much sound or much light.
Okay.
But this type of headache that came without any warning shot.
Okay. This time. Okay. Okay. And for this episode, have you taken any medication like paracetamol?
No, doctor, this is something new. So, and I thought that it may be something serious, so I didn't take anything.
Okay. Well, now let's come to your weakness and numbness. Well, can you please tell me that was it involving the whole right side of your body or only specific side?
My right hand and my right leg.
Okay. And you told that there were some abnormal sensation. Did you have any pain or numbness?
Some numbness, no pain.
Some numbness, no pain. And do you feel that your arms and legs are heavy, right arm and right leg?
Yes, doctor, I feel somewhat weakness, but the weakness isn't so severe.
So severe. Okay. And have you been able to walk since this episode began?
Yes, doctor.
Okay. Are you able to hold anything with your hands?
I didn't try because I felt some weakness, so I didn't try.
Okay. Yeah, that's all right. Okay. And you told that it started around 15 to 30 minutes after the headache. Well, can you please tell me that how severe was it at the beginning and how is it now?
It is almost same from the beginning.
Almost same. Okay. And okay, that's all right. And is it the first episode of weakness in your life that you have experienced, or have you experienced like this before also?
No, not like this.
Okay. And okay, may I ask you some questions now? Did you have any problem with your vision this time? Any blurring of vision or any double vision like that?
Yes, doctor. I noticed that I also cannot see properly. That is something hazy.
For how long?
After the headache came,
Okay. And is it still present, this problem?
yes, doctor.
Okay. Are you feeling any pain in moving your eyes? Do you think
No,
that there is any pain in your eye movement?
no,
Okay, that's all right. Both eyes or left eye or one eye?
right eye, doctor.
Right eye. Okay, that's all right. And have you experienced any vomiting this time? Any vomiting episodes?
No,
Okay. Any raised temperature
no,
recently? Okay. Any problem of your swallowing?
no,
Any problem of speech?
no,
Okay. Do you have any neck pain? Can you specify?
no,
Okay. And do you have any chest pain?
no,
Any racing and pacing of your heart?
no,
Okay. Any shortness of breath?
no,
Any cough?
no.
Okay. What about your water work? Is it all right?
Okay, doctor. Fine, it is.
Okay, it's fine. Okay. And your bowel movement?
It's normal.
Okay. And okay, it's normal. And do you have any joint pain?
No,
Any rashes in your body?
no,
Any pain in your muscles or joints
no,
or any other side?
no.
Okay. And okay. And you told that your right eye became hazy. Can you please specify that? Just what do you mean by this hazy? That you just couldn't see, or uh, there were some problems? Can you please specify more about it?
I think it is somewhat hazy that I cannot see
Okay,
properly.
you cannot see properly. That's all. Okay, yeah. Okay, that's all. That's all right. And can you please tell me that do you suffer from any long-term chronic diseases like hypertension or diabetes or anything like that?
No, I just have migraine,
Okay,
nothing else.
okay. And do you have any family history of any heart disease or any stroke or something like that?
No, I don't know.
Okay. And do you have any? Are you taking any medication apart from occasional paracetamol?
No,
Are you allergic to any medication?
no,
Okay. And okay. And are you on any ever been on any herbal medication?
no, never.
Okay. I'm sorry to ask. It's a personal question. Do you take any recreational medication?
No, doctor, never.
Okay. Okay. That's all right. I'm sorry to ask, but these have to be asked. And any okay. And do you have any? Do you smoke, Mrs. Wilson?
No,
Okay. Do you drink alcohol?
no.
Okay. And you told that your job was. Can you please specify again as a typewriter? Okay. For how long have you been doing this?
After
This
leaving my
typewriting.
college, doctor, that is about 25 years.
Okay. Okay. May I know that whom do you live with?
Live with my husband and children.
Okay. Okay. Are you well supported by your husband and
Yes, doctor,
are
yes.
you? Okay. Okay. That's all right. And may I ask you that do you have any recent history of travel to any country or something like that?
I went North America about 1 year back.
1 year back. Okay. And at the time, did you take any medicine or prophylaxis? What we tell for preventive medicines before going there?
No,
Okay. Okay. And this is again a personal question to ask. But uh, I'm very sorry to ask this. But you told that you are happily married. But have you ever been to any casual relationships?
no, never.
Okay, okay. I'm very sorry to ask, but this has to be asked. Okay, and okay, and may I know, Mrs. Wilson, what your concerns are?
2 minutes remaining. Okay, doctor, why
Yeah,
I
yeah.
am having this? Is it something serious like brain tumor?
Okay. Well, at this moment, actually, we have to first examine you properly and also assess you, and then we can uh, make sure that what has happened to you appropriately. But as long as we have taken the history, I think that you might be suffering from uh, a condition, okay, which is related to your migraine. Yes. So, so well, this is a migraine with hemiparesis, what we tell. But uh, well, these things can happen with migraine, and but we need to be sure at first. So for this reason, we will involve the uh, eye doctor, the nerve doctor, okay, and also a specialist. They will run some tests, some scanning tests as well. And as soon as we are sure about the diagnosis, we will uh, get to you again and help you mapping out a plan. Is that okay?
Okay, doctor, do I need any admission?
Hemiplegic. Well, at the moment, since we have to run some tests, and since you are still facing some weakness, so we will keep you under observation at first, so that you don't get worse. Okay. Yeah.
Okay, doctor.
Okay. Any more questions or concerns that I didn't address?
No, fine.
Okay. Okay. Okay.
Okay, so the time is up. So, what is your diagnosis?
Uh, well, I think that it might be a case of hemiplegic migraine. Not sure of it.
Any differential do you have?
I it can be and I think it can also be carotid artery dissection or vertebral artery dissection as well. And since there is headache, and we might also think of any mass lesions in the head present or not. But and also she has some haziness, so we might consider that also.
Okay, how will you investigate her?
Uh, First of all, we will do some routine blood tests like CBC, then also do the inflammatory markers like ESR, CRP, and we will do some scanning, both of his heart, like ECG, and also echocardiography, cardiac Doppler, and also at the same time we will consult with the nerve doctor, with the neurologist to uh, to be sure about the stroke by doing CT scan and even if necessary, diffuse weight MRI. Okay, and MRI, and I think these will be the tests.
Okay, do you think
And
that
also, I might.
do you that
Yeah.
think that serious scan is urgent investigation for this lady?
Well, I actually don't. I think that since considering her age, I think it might be necessary to rule out any any problem with in his brain, in her brain.
Okay, fine. So for this lady has two symptoms during her presentation. That is, one was some one was headache and one was some abnormal sensation or weakness on right side.
Yeah.
For headache, you have asked site, onset. You haven't asked criteria or character of this headache. Any radiation, you have asked about neck pain. And associated symptoms, you have asked about changes in the vision, not and also nausea, vomiting.
But
And
others actually you told yourself, so I didn't ask that your problems with
and
the.
okay, I'm coming for that. And also
Okay.
weakness, uh, that she voluntarily told that she has weakness. And after that, any timing of the pain, it was something sudden onset, and also was this same like the previous episodes, or this time was different. She described that different. Then has she noticed anything that makes his pain worse or better? You haven't asked it. That
Mhm.
coughing, sneezing makes it worse or better. Signs of resting.
Mhm. Yeah, yeah, yeah.
And any relieving factors. And then
Mhm.
severity. You haven't asked about severity scoring. And
Yeah.
also for this lady, for any type of symptoms, that is called red flag signs.
Yeah.
You haven't asked all the red flag
Yeah.
signs, like fever you have asked, neck pain you have asked, any changes in vision you have asked, any weakness at inside, well, she already had, and any anorexia, weight loss, any other
Mm.
focal weakness,
Mm.
the
Mm.
also memory problem you could have asked, and any morning headache.
Mm. Mm. So can you please tell again a memory problem, morning headache, what else?
Okay, from the head, for headache, I remember by asking any change for headache, any morning headache,
Mm.
any changes in the vision,
You can. Mm.
any anorexia, nausea, weight
Now
loss,
sure. Mm.
any neck pain, fever, any
Yeah.
focal weakness.
Yeah. Yeah. Mm.
Okay, and
Yeah.
for the changes in the sensation, this sensation was totally new to her.
Mm.
Sensation was it from the beginning involved the whole site, or was it focal and then it radiates? You should have asked it that it may
Okay. Okay.
start at the leg and then went to the arm
Mm-hmm.
or
Mm-hmm.
so site.
Yeah.
Then onset, you have asked that onset, and was it progressing or relieving? You have
Mm.
asked it. Then how she characterized this type of sensation? You have
Mm.
asked it. And with
Mm.
associated symptoms, any pain,
Mm. Mm.
any weakness, you have asked it.
Mm.
Okay.
Mm.
Then
Mm.
eliciting factor or activating factor,
Mm.
and also her severity. Can she do her job now?
Mm. 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 Mm.
And after that, in the meantime, you have got all the clues for diagnosis, because the symptom is, though the patient has a history of migraine, but this type of symptom is totally new to her.
Yeah.
Then in the past history, you have asked it well. In the drug history and family history, you have messed up. That first you have asked some family history points, then you have asked again drug history points, then again you have asked about family history points.
Yeah.
And also, before asking the personal history, you didn't seek permission that I'm going to ask you a few more personal questions. Is it okay for you?
Okay.
That asking the personal history is somewhat bothering. So you should have
Yeah.
taken
Yeah.
permission for that.
Yeah. 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 Yeah.
And I
Yeah. I
can
get it.
remember that if you have asked about driving issue or not.
No, I didn't just. I forgot.
Okay, that was another important thing.
Yeah. Yeah. That's very important. Yeah.
And in the diagnosis, that it can be a case of hemiplegic migraine, but she also has signs of visual symptoms, abnormal sensation, and also the symptoms came after a few times, uh, starting of headache. So it is most likely that something intracranial events like any hemorrhage, any cerebrovascular accident, or any type of
Mm.
uh,
Mm.
intracranial scopoingulation,
Mm. Mm.
even multiple sclerosis.
Mm.
Okay,
Yes.
so you
Yeah.
should have asked, you should have ruled out those, because this is totally a new symptom. So you cannot ignore that. You
Mm.
cannot tell that it is simply a migraine.
Yeah. 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 Yeah.
New symptom, always new symptom. So this requires urgent investigation.
Yeah. Yeah.
And also for this lady, I cannot remember that you haven't asked about its period pregnancy.
Yeah.
Just
Yeah.
taking OCP also increases the risk of CVD.
Mm. Yeah.
Overall, this was fine.
Well, what was the case actually? It's all.
Okay, this case, the diagnosis isn't confirmative in this case. That they are considering that it can be a case of cerebrovascular accident.
Okay. Yeah. Okay. Okay.
It's confirmatory that what is the actual case, but it brings the broad
Mm.
differential where the cerebrovascular accidents comes first.
Yeah. 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 Okay. It